Can a cat wound infection spread to humans? Have you ever wondered if a cat's wound infection could affect you? It's a valid concern for any pet owner. Let's break down how this can happen and what you should know. Yes, cat wound infections can indeed spread to humans. This transmission often occurs through direct contact with infected wounds or from bites and scratches. Cats naturally carry bacteria in their mouths and on their claws. When they bite or scratch, they can introduce these bacteria into human skin. Bite wounds are particularly risky. A cat's sharp teeth can inject bacteria deep into tissues. The oral bacteria of cats include organisms like Pasteurella ungknown, Streptococcus, and Staphylococcus. These can lead to quick infections in humans. Even minor scratches can pose a risk if the cat's claws are contaminated with saliva or infected fluid. Direct contact with an infected wound on a cat can also be dangerous. If you handle a cat with an open abscess without wearing gloves, you might expose yourself to pathogens. One example is Sporothrix schenkii, a fungus that can cause sporotrichosis. In terms of pathogens, bacterial infections are common. These often involve a mix of aerobic and anaerobic bacteria. Fungal infections, like sporotrichosis, can spread through contact with draining lesions. There are also parasites, such as Bartonella henselae, which cause cat scratch disease and can be transmitted through scratches. If you do get infected, you might notice localized redness, swelling, and pain at the injury site. If left untreated, these symptoms can progress to systemic issues like fever and fatigue. People with weakened immune systems are at a higher risk for severe complications. So, what can you do to protect yourself and your family? First, if you get bitten or scratched by a cat, clean the wound immediately with soap and water, then apply antiseptic. Seek medical attention for any bites or scratches that break the skin, especially if you notice redness or swelling. Preventive measures are also essential. Keeping your cat indoors can reduce exposure to infectious agents. Regularly trimming their claws and discouraging rough play can help minimize the risk of injury. When handling infected wounds or cleaning litter boxes, wearing gloves is a smart choice. Finally, ensure your cat receives routine veterinary care. This includes parasite control and proper wound management. As a pet owner, being proactive about wound care can significantly lower the risk of infections spreading to you. If your cat has a wound, avoid direct contact and consult your veterinarian for safe handling practices.